aflibercept, bevacizumab, or ranibizumab for diabetic edema. The diabetic edema is an accumulation of fluids in the macular, part of the retina that controls or must attain vision abilities due to leaking blood vessels. In order to develop DME, you must first have the diabetic retinopathy. The method. At 89 clinical sites, we randomly assigned 6,600 adults, mean age 61 plus and minus 10 years, with diabetic macular edema involving the macular center to receive intravenous aflibercept at a dose of 2.0 milligrams to 124 patients. Bevacizumab at a dose of 1.25 milligrams in 218 participants, and ranibizumab at a dose of 0.3 milligrams. The results. From a baseline to 1 year, the mean visual acuity letter score improved by 13.3, aflibercept by 9.7 with bevacizumab, and by 11.2 with ranibizumab.
Welcome to the Science of DME, presented by the Angiogenesis Foundation. This animation describes the development of diabetic macular edema and empowers you, as a diabetes patient, to manage your condition. Diabetic macular edema, or DME, develops as a complication of diabetes and is a leading cause of vision loss among working adults. Anyone with type 1 or type 2 diabetes is at risk. Diabetes occurs when the pancreas, a gland between your stomach and your spine, fails to produce adequate levels of insulin or is unable to use the insulin properly. This harms the body's natural ability to control blood glucose levels, which become dangerously high without consistent management. High levels in blood glucose can lead to a number of conditions, including vision-threatening diseases such as diabetic retinopathy and DME. DME can occur at any point in the progression of diabetic retinopathy, so the presence of both conditions must be monitored to prevent vision loss. DME involves the retina, the tissue at the back of the eye that receives and processes what you see, and the macula, which is a small part of the retina critical for seeing clearly. DME occurs when blood vessels leak fluid into the retina and macula, causing edema. Why does this happen? Retinal blood vessels become weak or blocked when blood glucose levels are too high, such as in diabetes patients. The retina cannot receive enough blood or oxygen and sends signals to surrounding tissue for nourishment. VEGF is then released at abnormally high levels. Too much VEGF weakens the vessel wall and makes it more penetrable, so blood vessels become leaky. As the vessels leak fluid and blood into the retina and ultimately the macula swells and thickens. This is the condition known as macular edema. Swelling of the macula causes vision to become blurry. Colors may also look faded or washed out, and spots may appear in your vision if blood has leaked into the eye. These changes are very sudden and usually occur in the late stages of DME when treatment is less effective. Do not wait for symptoms, or as recommended by their doctor, before experiencing any changes in vision. According to the Center for Disease Control and Prevention, up to 50% of diabetes patients do not get their eyes examined or are diagnosed when it is late for treatment to be effective. If timely treatment is not obtained, DME can lead to severe and even permanent vision loss. Don't let this be you. Get comprehensive eye exams consistently. If DME is found, your eye care specialist may perform other tests to assess the extent of your condition. A fluorescein angiogram may be used to take images of the inside of your eye, and optical coherence tomography, or OCT, is another imaging tool that measures the thickness of your retina. The risk of developing DME increases with the duration of diabetes, as well as abnormal levels in blood glucose, blood pressure, and blood lipids. Other diabetes complications, kidney disease, cardiovascular disease, smoking, obesity, and pregnancy may also increase your risk for DME. You can lower your risk by controlling any modifiable risk factors you may have, managing your diabetes consistently, and of course, getting comprehensive eye exams as often as your doctor determines. If you or a loved one has been diagnosed with DME, learn about your treatment options.
The results. Although the improvement was greater with aflibercept than with the other two drugs, the bevacizumab and the ranibizumab, it was not clinically meaningful because the difference was driven by the eyes with worse visual acuity at baseline. The conclusions. Intravenous aflibercept, bevacizumab, or ranibizumab improved vision in eyes with center-involved diabetic macular edema, but the relative effect depended on baseline visual acuity. When the initial visual acuity loss was mild, there were no apparent difference on average among study groups.